When was the last time you looked closely at your fingernails? Most people use their nails to trim, clean, or paint them, but very few realize that your nails can sometimes provide important clues about your overall health. In fact, doctors don't just examine your heart by listening to it with a stethoscope. During a physical examination, they may also look at your hands and fingernails because certain nail changes can sometimes be linked to problems with circulation, oxygen levels, or other medical conditions. If you're over the age of 60, this is something worth paying attention to. As we get older, conditions such as high blood pressure, clogged arteries, heart valve disease, heart failure, and poor circulation become more common. While your nails cannot diagnose heart disease, unusual changes in their color, shape, or texture may sometimes be a sign that your body needs medical attention. However, it's important not to jump to conclusions. Many nail changes are completely harmless or caused by other conditions such as aging, nutritional deficiencies, fungal infections, injuries, thyroid disease, lung disease, or simply years of wear and tear. That's why it's never a good idea to diagnose yourself by looking at your nails alone. Instead, think of your nails as one possible clue, a signal that should be considered along with your symptoms, medical history, and a proper examination by a healthcare professional. In today's video, we'll discuss 8 nail changes that cardiologists and other doctors may pay attention to during a physical exam. We'll explain what each sign could mean, why it happens, and when it's important to seek medical advice. Some of these signs may be completely harmless. Others could point to circulation problems, low oxygen levels, or conditions that deserve further evaluation. Stay with me until the end, because the final nail sign is often mistaken for a normal part of aging, yet it can sometimes be associated with reduced blood flow to the hands and fingers. Welcome to Dr. Bilal, where we make medical information simple, practical, and easy to understand so you can take better care of your heart and your health after 60. Now let's begin with the first 2 nail changes that may sometimes be linked to heart or circulation problems. Remember, these signs do not automatically mean you have heart disease. Many other medical conditions can cause similar changes. The important thing is to notice persistent or unexplained changes and discuss them with your healthcare provider. Nail sign. Number 1, blue or purple nails. Take a close look at your fingernails. Do the nail beds appear blue, purple, or gray even when you're warm? Healthy nails are usually light pink because they receive a good supply of oxygen-rich blood. When the nails begin turning blue or purple, it may mean that less oxygen is reaching your tissues. Doctors call this cyanosis. This change can occur because of serious heart problems, certain lung diseases, poor circulation, or other conditions that reduce the amount of oxygen in the blood. Sometimes cold weather can temporarily make your fingers look bluish. That's usually harmless and improves once your hands warm up. However, if your nails remain blue without an obvious reason, or if the color change is accompanied by shortness of breath, chest pain, dizziness, or confusion, seek medical care immediately. These symptoms may require urgent evaluation. Nail sign number 2, clubbing of the fingertips. The second sign is called clubbing. This happens when the tips of the fingers become enlarged and the nails begin to curve downward over the fingertips. Unlike normal nail growth, clubbing usually develops slowly over months or even years. So many people don't notice it at first. Doctors believe clubbing may occur because of long-term changes in oxygen levels or blood flow that affect the tissues beneath the nails. Although clubbing can sometimes be associated with certain heart conditions, it is also commonly seen with lung diseases, liver disease, inflammatory bowel disease, and several other medical conditions. In other words, clubbing is not specific to heart disease. If you notice that your fingertips have become rounder or your nails curve much more than they used to, don't ignore the change. It's worth discussing with your healthcare provider, especially if you also have symptoms like persistent coughing, breathlessness, chest discomfort, or unexplained fatigue. Your fingernails may seem like a small part of your body, but sometimes they provide valuable clues about what's happening inside. Let's continue with the next 3 nail changes. These signs do not confirm heart disease, but they can sometimes point to problems with circulation, blood health, or other medical conditions that deserve attention. Nail sign number 3, pale nail beds. Healthy nail beds are usually light pink, showing that oxygen-rich blood is flowing normally through the tiny blood vessels beneath the nails. If your nail beds look very pale or almost white, it may be a sign that something is affecting your blood circulation or the amount of oxygen being carried through your body. One common cause is anemia, a condition in which your body doesn't have enough healthy red blood cells. However, pale nails can also be seen in people with poor circulation, chronic illness, kidney disease, or heart failure. Take a simple look at your nails in natural light. If they have become much paler than they used to, especially if you also feel tired, weak, dizzy, or short of breath, it's a good idea to schedule a medical checkup. Nail sign. Number 4, tiny dark lines under the nail. Have you ever noticed thin black or reddish brown lines running from the base of your nail toward the tip? These are called splinter hemorrhages because they look like tiny wooden splinters trapped beneath the nail. Most of the time, they happen because of a minor injury, such as accidentally hitting your finger. However, when splinter hemorrhages appear without any injury, especially on several nails, doctors may consider other possible causes. In rare cases, they can be associated with infections of the heart valves or certain blood vessel conditions. Because there are many possible explanations, it's important not to panic. But if these lines appear repeatedly or are accompanied by fever, fatigue, or other unusual symptoms, they should be evaluated by a healthcare professional. Nail sign number 5, spoon-shaped nails. Another change doctors sometimes notice is spoon-shaped nails, also known as koilonychia. Instead of curving slightly outward, the nails become thin and curve inward, creating a shape that could hold a tiny drop of water. This condition is most commonly linked to iron deficiency anemia, but it may also occur with other nutritional deficiencies or certain medical conditions. Why does this matter for your heart? Because severe anemia can make the heart work much harder to deliver oxygen throughout the body. Over time, this extra strain may worsen existing heart problems, especially in older adults. The important message is this: your nails don't tell the whole story, but they can offer valuable clues. Changes in nail color, shape, or texture should never be ignored if they are new, persistent, or accompanied by symptoms such as chest pain, breathlessness, dizziness, swelling, or unusual fatigue. We've already discussed 5 possible nail changes. Now let's look at the final 3 warning signs. Remember, these changes do not prove you have heart disease, but they may be clues that your circulation or overall health deserves medical attention. Nail sign number 6, slow capillary. Refill. Here's a simple test that doctors often perform during a physical examination. Gently press on the tip of one fingernail until it turns white, then release it. In most healthy people, the pink color returns within about 2 seconds as blood flows back into the tiny blood vessels beneath the nail. If the color takes noticeably longer to return, it may suggest reduced blood flow or poor circulation. However, this test is not a reliable way to diagnose heart disease at home. Cold temperatures, dehydration, low blood pressure, or other medical conditions can also affect the result. Think of it as one small clue, not a diagnosis. Nail sign number 7, cold, brittle nails. Do your fingers often feel cold even when the room is warm? Have your nails become unusually brittle, breaking or splitting more easily than before? As we age, circulation to the hands may naturally become less efficient. But persistently, cold fingers, especially when combined with changes in nail color, numbness, pain, or slow healing of small cuts, may indicate reduced blood flow. Poor circulation can have many causes, including peripheral artery disease, diabetes, smoking, or certain heart and blood vessel conditions. Brittle nails themselves are very common and are often caused by aging, frequent hand washing, or nutritional deficiencies. But when several circulation-related symptoms appear together, they deserve medical evaluation. Nail sign number 8, sudden changes in nail color or shape. Perhaps the most important warning sign is a sudden change. If your nails quickly become darker, thicker, unusually curved, or develop new discoloration without an obvious injury, don't simply assume it's a normal part of getting older. Although many nail changes are caused by fungal infections or harmless conditions, sudden or unexplained changes should always be checked by a healthcare professional. Your nails may be providing an early clue that something else in your body needs attention. When should you see a doctor? Don't wait until symptoms become severe. If you notice persistent blue or purple nails, clubbing, pale nail beds, unexplained dark lines, sudden nail changes, or signs of poor circulation, schedule a medical appointment, especially if these changes are accompanied by chest pain, shortness of breath, dizziness or fainting, swelling in the legs or feet, unusual fatigue, rapid or irregular heartbeat. Remember, early evaluation doesn't always reveal a serious problem, but it gives your healthcare provider the opportunity to identify and treat conditions before they become more advanced. Your nails may seem like a small detail, but sometimes they provide valuable information about your overall health. Let's take a moment to review what we've learned today. Your fingernails may seem like a small part of your body, but they can sometimes offer important clues about your overall health. Doctors often examine the hands and nails during a physical examination because certain changes may be associated with circulation problems, low oxygen levels, anemia, nutritional deficiencies, lung disease, or, in some cases, heart conditions. Today, we discussed 8 nail changes that should never be ignored if they are new, persistent, or occur along with other symptoms. These included blue or purple nails, clubbing of the fingertips, pale nail beds, tiny dark lines under the nails, spoon-shaped nails, slow capillary refill, cold or brittle nails, and sudden changes in nail color or shape. But here's the most important message from today's video. None of these nail changes can diagnose heart disease by themselves. Many of these signs have completely different causes. Some may be related to aging, fungal infections, minor injuries, vitamin or mineral deficiencies, thyroid disorders, lung disease, or other common health conditions. That's why it's so important not to panic if you notice a change. Instead, use it as a reason to pay closer attention to your health. If a nail change doesn't go away, gets worse, or appears together with symptoms like chest pain, shortness of breath, dizziness, swelling in your legs, unusual fatigue, or a rapid heartbeat, don't ignore it. Schedule an appointment with your healthcare provider as soon as possible. Remember, early evaluation saves lives. The sooner a heart problem or circulation disorder is discovered, the more treatment options are usually available. Many heart conditions can be managed much more effectively when they're diagnosed early, before they lead to serious complications such as heart attacks, strokes, or heart failure. You can also lower your risk of heart disease by focusing on the habits that truly matter. Keep your blood pressure, cholesterol, and blood sugar under good control. Stay physically active by walking and doing strength exercises regularly. Eat a balanced diet, rich in vegetables, fruits, whole grains, lean protein, and healthy fats. Avoid smoking, limit alcohol if you drink, maintain a healthy weight, get enough sleep, and attend regular medical checkups, especially after the age of 60. These daily habits have a much greater impact on your heart than any single warning sign. Thank you for watching, Dr. Bilal. If you found today's video helpful, please give it a thumbs up, subscribe to the channel, and turn on the notification bell so you never miss our latest evidence-based health videos designed especially for adults over 50 and 60. If you have a parent, grandparent, or friend over 60, share this video with them. It may encourage them to notice important health changes early and seek medical advice before a small problem becomes a serious one. Until next time, take care of yourself, stay informed, and remember, sometimes your body whispers before it screams. Listening to those early signs may help protect your heart and your future. I'll see you in the next video.